Mayor Lenny Curry is speaking about coronavirus, especially the Delta variant surge we've been seeing. Let's listen in.
CEO of UF Health Jacksonville, Dr. Kent Thielen, CEO, Mayo Clinic in Florida, Michael Mayo, President and CEO, Baptist Health, Dr. Timothy Groover, Chief Medical Officer, Baptist Health, Tom Van Osdol, President and CEO, Ascension, Florida and Gulf Coast, Doug Baer, President and CEO, Brooks Rehabilitation, Dr. Sunil Joshi, President, Duval County Medical Society Foundation, Captain David Barrows, Executive Officer, Naval Hospital, Jacksonville, Stephen Woodard, Director, Emergency Preparedness Division, and our beaches mayors, Atlantic Beach Mayor Ellen Glasser, Jax Beach Mayor Chris Hoffman, and Neptune Beach Mayor Elaine Brown. Last week, as we have throughout the pandemic, I met with leaders from our local hospitals to discuss the recent increase in COVID-19 cases we've experienced in our area. Many of these leaders are here today. I'm grateful for their advice and guidance through these long months for our city, state, and nation. In those meetings and those discussions, they have reaffirmed what I've been saying for weeks. The data shows that nearly all patients suffering severe symptoms from this virus in our hospitals right now are not vaccinated. The results are clear. The shots work. They're highly effective in preventing severe illness and death from COVID-19. Per the Centers for Disease Control, of the 18,000 deaths our country experienced because of this virus in May, 99.7% of those patients were not fully vaccinated. The vaccine is the best tool we have to protect ourselves, our friends, our neighbors, and our loved ones. Despite having access to the vaccines, we're seeing hospitalizations for this virus here in Jacksonville at a level we haven't seen since the height of the pandemic last year. We have a better solution this go around, a solution that helps prevent severe illness and death, and that is the vaccine. A vaccine that is accessible to basically anyone who wants it. And so my overall message to the citizens of Jacksonville, and I'm sure my colleagues from our hospitals here agree with me, my message is this: please get the vaccine. The easiest way to find a vaccine location near you is to go online at vaccines.gov and type in your zip code. You'll be provided a map with all the vaccine locations in your area, and you can sort by vaccine type to get Pfizer, Moderna, or Johnson & Johnson shots. This is something that affects all of us as an entire community, including our beaches cities. We're all in this together. As I said earlier, the mayors of Atlantic, Neptune, and Jacksonville Beach are part of this press conference, and we are unified in this message. Please get vaccinated. It works, it's effective, and it could save your life. Of course, you don't have to take our word for it. I'm no medical expert, but I've been fortunate to receive the advice and guidance from some of the brightest medical minds and leaders in the healthcare industry. To talk more about this recent surge in COVID-19, its effects here locally, and strategies we can take as a community and individuals to address it, I'm going to ask some of our area medical leaders to make brief remarks. But before I ask our local medical leaders to share their stories, I'd like to ask our local media to please stick with their live coverage throughout the remainder of this press conference, if possible. Each of these individuals will share what they're seeing in their hospitals and practices. I know this may take a little longer than usual. However, we're here today to share a message that will encourage vaccines and ultimately save lives. There's nothing more important to this. I know I'm going to get asked about restrictions, so let me go ahead and address that now. The path to moving beyond this surge and preventing future ones is increasing our percentage of vaccinations. The math is clear. Vaccines work. Restrictions to our economy and personal freedoms are not the answer. The answer is getting vaccinated. And with that, I'm going to hand things over to Dr. Leon Haley from UF Health.
Good afternoon, Mr. Mayor, and to our audience today. And thank you for reiterating the message that many of my colleagues on the line today will also reiterate, which is around the value of the vaccinations. Just to paint a picture, at UF Health as of this morning, 136 active patients between our two campuses. That's an all-time high for us. During last summer's peak, we were at 113. Over the course of the winter, 122, and now at 136. 41 of those patients are in an ICU, and 15 of those are on a ventilator. And one of those is actually receiving ECMO, which is an advanced treatment to take care of patients with significant lung effects from COVID. So we have seen a significant rise in our patient population. Just 1 week ago, we were at 75. The previous week we were at 45. Previous week we were at 20. So almost a quadrupling of our numbers over the last couple of weeks. And as the mayor said, 90% of our patients that are currently hospitalized are unvaccinated. About 5% did not complete the vaccination process. And we are seeing a small percentage of people that are vaccinated. So it is possible for people to turn positive with having had the vaccine, but they are hospitalized at a much lower rate. And we're seeing a significant decrease in the significance of their illness as well as their deaths. Those 5% that are vaccinated are those with significant comorbidities or in many cases on an immunosuppressant drug, so an extreme population. Unfortunately, the other side of what we're seeing is the significant increase in our deaths. So we've had 18 deaths since the beginning of July. We had 4 for the entire month of June. 100% of those deaths are related to unvaccinated individuals. We've also seen a shift in the age population. In January of last year, it was 67 and is now 57, so a younger population. We've also seen a shift in the demographics in terms of race. And so unfortunately, it is now 55% are white and 34% are African American, which is different than what we saw earlier. So we're seeing a shift in the demographics in terms of age and race. But most importantly, as the mayor said, we're seeing people who are in the hospital who are unvaccinated. And so I would implore you to continue your mask and distancing and washing your hands. I think those are still appropriate measures. But the most important, as the mayor said, is to get vaccinated as soon as you can, because that is the way we're going to beat this pandemic. So thank you for the opportunity to share some thoughts with you, Mr. Mayor.
And now we have Dr. Kent Thielen, CEO of Mayo Clinic.
Good afternoon. Thank you, Mayor Curry, for the opportunity to join you and all our colleagues from the other health systems to share just a little bit regarding the COVID surge we're experiencing here in Jacksonville and how we as citizens can best respond to protect ourselves, our families, and our community. And I just want to say thank you to all our healthcare workers for their continued dedication as together we're responding to the current COVID surge. By way of background, similar to the report from Dr. Haley, at Mayo Clinic in Florida over the past 3 weeks, we've experienced a significant increase in the trajectory of new COVID diagnoses and hospitalizations. Like other Jacksonville hospitals, we're currently approaching our previous peak numbers of COVID hospitalizations, similar to what we experienced back in January earlier this year. This represents a 5-fold increase in COVID hospitalizations and follows many weeks when we only had a handful of hospitalized COVID patients. Of note, over the past few weeks, we've seen an increase in the number of hospitalized patients who have breakthrough previously fully vaccinated status. It tends to be less than 20% of our patients. The good news is when these breakthrough cases occur, they tend to be much less severe, with only the rare patient needing to progress to ICU level of care. And we're not seeing deaths in this group of patients as well, re-emphasizing the point from Dr. Haley. In our outpatient environment, where we have our Mayo Clinic drive-through testing center, we now have greater than 20% COVID test positivity for the last few weeks, and that's after being below 5% for many weeks. Over the same period, we've experienced an increasing demand for COVID testing, now resulting in a 5-fold increase in the drive-through testing volume on a day-over-day basis. Similar to the hospitalizations over the past 3 weeks, we've experienced an overall significant increase in the total number of diagnoses, as well as an increase in the breakthrough positivity rate of patients who were previously vaccinated. Similar to the report from Dr. Haley, the vast majority of these patients have much less severe cases. We have utilized our sequencing capabilities at Mayo Clinic to analyze a subset of these breakthrough previously vaccinated, both outpatients and inpatient COVID cases. We've confirmed in this limited subset of patients that they're almost all the Delta variant, and that's responsible for these breakthrough cases that we've seen. As we're experiencing here in Northeast Florida, the more highly contagious Delta variants become the dominant strain of COVID in the United States. which is really adding urgency to the need for COVID-19 vaccinations. If you haven't already done so, it's critical to move quickly to get vaccinated. 2 doses of the mRNA vaccines, Pfizer or Moderna, they provide 80+% protection against the Delta variant. These vaccines have the added significant benefit of reduced severity of disease if one were to have one of these rare breakthrough infections. And lastly, I want to reemphasize the importance of taking advantage of those simple things like masking, hand washing, and social distancing, particularly during this time of increasing COVID positivity in our community. They're simple and highly effective, and they really do reduce the chances of becoming infected with COVID. So thank you again, Mayor, for the opportunity to join you today.
Thank you. Tom Van Osdol, President and CEO. I'm sorry. Michael Mayo, President and CEO of Baptist Health. Stand in order. Can you unmute? Michael, I think you're muted.
Sorry. Thank you, Mayor, for allowing me and my colleagues this opportunity to speak with you to our community. I'd first like to start by acknowledging that making a decision about the COVID-19 vaccine is a serious one, and there are no options without some degree of risk. So what we ask is that for people to keep an open mind and weigh the risks and benefits. Our mantra at Baptist Health is to ask questions, be informed, and make a decision that is best for you. On that note, it is very important to listen and share information at every opportunity. I've had the opportunity to continue communications with all of our team members and many in our community who were previously on the fence and now have decided to get the vaccine, and have found in that some common themes that I'd like to share with you. First of all, a lot of time has passed since the vaccine was first made available, and many initial fears have been dispelled and people are getting vaccinated. Most people are hearing positive things about the vaccine from people they trust, such as their physicians, friends, relatives, people at their employment, or in their faith communities. So if you've been vaccinated, I urge you to have an open dialogue with your friends and family about why you made this decision. I don't recommend arguing or badgering others, but simply sticking to the medical facts and your own personal experience. I know there are many who are concerned about vaccine risk. Among them are women of childbearing age who are worried about fertility and the ability to bear children. I would encourage them to research the latest facts as put out by the American College of Obstetricians and Gynecologists and talk with their personal physician and OBGYN physician. It's important to get the latest information from reputable sources. Today, I'm very fortunate to have my colleague, Dr. Timothy Gruber, Chief Medical Officer at Baptist Health, to provide some details about what we're seeing, especially the difference in the ages of patients we are seeing now versus what we saw in the earlier pandemic. Dr. Gruber?
Thank you, Dr. Mayo. Before I begin, I wanted to just remind everyone of how deadly this virus is. In the United States, over 609,000 people have died due to COVID-19. Think about that. I don't mean to be morbid, but if you lined up that many people from head to toe, they would stretch from Jacksonville to Miami and halfway back. So we're not talking about the cold. We're not talking about the flu, or even the same virus that we were dealing with this time a year ago. Our latest numbers show that 69% of the cases that are being admitted to Baptist Health are attributed to the Delta variant. Because of its very efficient and effective transmission from human to human, the patients that we're seeing in the hospital today are younger, they're sicker, and they're getting sicker quicker. And in the past month at Baptist Health, 44% of COVID-19 positive hospitalized patients were in their 40s or even younger. These are people who are typically in the workforce, but are absent today because they're in our hospital. Most were previously healthy, moms, dads, brothers, sisters, who are now hospitalized because of the virus. Even when these patients return home from the hospital, some struggle for months with fatigue and other long-lasting symptoms, including cardiac and pulmonary conditions that keep them from returning to their normal activities, including work. So the implications reach far and wide. Back in March of 2020, we were viewing this as a disease of older adults, especially those with chronic medical conditions. But today, we are seeing those who are otherwise young and healthy end up in our hospital and even in our ICU on ventilators. How were these people infected? Well, primarily through the transmission of droplets. The CDC modeling study estimated that 59% of transmissions occur from asymptomatic individuals. And we know that people who are unvaccinated carry a higher load of the virus, making them more contagious without them even being aware of it. That's why masking remains important in addition to the vaccine, especially in the hospital. Believe it or not, we have people that are questioning us today. Why is it necessary for me to wear a mask 100% of the times when I'm in your facility? That's why. So I'll end on this note. According to the American Medical Association, 96% of surveyed US physicians have been fully vaccinated for COVID-19. I can assure you that these medical professionals did their research. So today, we encourage you to continue to seek trustworthy information and make an informed decision about getting the COVID-19 vaccine. Thank you.
Thank you. Now, Tom Van Osdol, President and CEO, Ascension, Florida, and Gulf Coast.
Thank you, Mayor Curry. I appreciate the opportunity to be with you and with all my colleagues today. I want to thank you personally for your leadership and collaboration and open communication throughout the course of this pandemic with the healthcare community. And I also want to take an opportunity to recognize and thank all healthcare workers throughout our community. You are true heroes, and you are continuing faithfully and selflessly today, and you have my deepest respect and gratitude. We at Ascension St. Vincent's are experiencing increases in COVID positive hospitalized patients, similar to all of my colleagues, similar story throughout the broader community. I want to emphasize that we are managing safely and effectively. We have our surge management plans in place, and we continue to have plenty of space and equipment and supplies and personal protective equipment. And we are continuing to ensure open access for patients for surgical procedures and for all other types of care that they need. Folks need timely access to care, and we want to make sure that we're here and able to provide it, whether you're seeking treatment for COVID or any other medical condition. We, like my colleagues, are continuing to see a largely unvaccinated population hospitalized within our campuses. Over 96% of the patients that we have hospitalized with us who are positive for COVID are not vaccinated. We similarly are seeing the median age of our population skewing younger. Today, our median age of our hospitalized patients is 49. It was in the mid-60s in prior waves of this pandemic. So it's a younger demographic who are not getting vaccinated and unfortunately are contracting COVID, and those cases are requiring hospitalization for treatment. So like my colleagues, I'll close with a plea and an encouragement that everyone get vaccinated as soon as you're able to do so. It is the way forward out of this pandemic. It is the way for all of us to get back to doing the things that we love to do. And in addition to vaccination, as has been mentioned, please continue masking, social distancing, and hand washing. Thank you. I appreciate the opportunity.
Thank you. Doug Baer, President and CEO, Brooks Rehabilitation.
Good afternoon. I'd like to recognize the unique collaboration that exists with the participants on today's call. You know, some of these hospitals compete fiercely with each other. We've all worked closely during this pandemic and sharing best practices and resources and ideas to combat this virus. You know, and our community really benefits from this coordination. And Mayor, I commend you as well for working with us and asking for our advice over this past year and a half and for bringing us together today. My organization, Brooks Rehabilitation, provides a rehabilitation system of care after the acute care hospital stay. And we're working hard to support the acute care hospitals and see their patients as they discharge. Rising COVID cases have put a strain on our facilities as well. And we, like the others, have seen an increase in COVID patients and exposures to our employees. And one aspect that shouldn't be overlooked is the stress on our employees at the hospitals after this long period of COVID fatigue and thinking that the pandemic was near the end. And it's now very disheartening for all of us to experience these spikes in cases in the hospitals, and especially knowing that they could be prevented by more people being vaccinated. So please get vaccinated if you have not been, and stay safe. Thank you.
Thank you. We've got 3 more speakers. I just want to thank media for sticking with us through this press conference. We're getting close to conclusion and taking questions. We now have Captain David Barrows, Executive Officer, Naval Hospital, Jacksonville.
Thank you, Mr. Mayor, and community members. We're really appreciative of being able to work with the hospitals in our local community, as well as the leaders of our military facilities throughout the area with the fighting of COVID. Here at the Naval Hospital Jacksonville, our priority has been to protect our staff, as well as our active duty service members, their families, the retirees, and our civilian workforce as well. Part of our mission is to keep our fighting forces ready to fight tonight, and part of that is to fight the pandemic and make them as safe as possible with offering them vaccinations. We currently require masking at our facilities, and we encourage frequent hand washing as well as social distancing at our healthcare facilities, as we do know that, as one of our other colleagues pointed out, that this virus spreads rapidly by aerosol transmission. That being said, vaccination is the best way out of this at this time. Like many of the other facilities, we're seeing similar statistics. Although I can't comment on those directly due to our operational requirements, there is a very similar pattern here at Naval Hospital Jacksonville. With regards to the vaccine, we were one of the first DoD facilities to offer the vaccine starting back in December, and have provided about 64,000 vaccines to our regional area, to our staff, family members, retirees, and DoD civilians. This is the vaccines are not they're not live viruses, so you can't get COVID from it. The vaccines are they don't interact with your DNA in any particular way, and they've had 5 times the number of patients looked at in terms of the studies typically for the standards. And with the Delta variant being over 200% more infective and 1,000 times the viral load of some of the other variants, it is definitely one force to be reckoned with, and the way to do that is by getting a vaccine. I took 2 tours in Iraq, and I used body armor for both of them because I didn't want to get hit by small arms fire and shrapnel. And I found, as an practicing anesthesiologist, also the best body armor that we offer our staff and our active duty service members is this vaccine. So I'm a firm believer in it, and I highly encourage everyone to get the vaccine if available. So go get the vaccine. Thank you, Mr. Mayor.
Thank you. Dr. Sunil Joshi, President, Duval County Medical Society.
Thank you, Mr. Mayor, and thank you for your leadership during this pandemic and for bringing us all together for this informative press conference. You know, as a physician on the ground, I feel like it's important for us to clarify some of the misconceptions related to the vaccine, and I've got a couple of points I want to make here. One is, you know, none of us have ever said that these vaccines, that the COVID-19 vaccines, are 100% effective at preventing infection. What we have been suggesting is that these vaccines are indeed very, very effective at preventing severe illness and hospitalizations. In fact, the CDC released some data last week that yes, roughly about 5,500 fully vaccinated people in the United States have required hospitalization due to COVID-19. But this is out of 161.7 million people who have been vaccinated. So in other words, this gives you a chance of being hospitalized of 0.0003 if you have been fully vaccinated. That's a 1 in 29,000 chance that you would be hospitalized if you received both doses of the vaccine or the 1 dose of the Johnson & Johnson vaccine. So it's the risk of being hospitalized or having severe illness with the vaccines is significantly lower than that group that's unvaccinated. So I wanted to make sure we cleared up that misconception. It can certainly still be positive, but not to the extent where you need to require hospitalization. I also think there's some misleading information regarding the effectiveness of the vaccines against the Delta variant. You may have read reports of how the Pfizer and Moderna vaccines are approximately 64% effective at preventing infection from the Delta variant. And though this is true, those same vaccines are 94% effective at preventing severe illness and hospitalizations and death from the Delta variant. So I think it's very, very important to remember that this vaccine is 94% effective at preventing severe illness from that Delta variant that we hear about. Another misconception is that natural infection is better than getting the vaccine itself. Unfortunately, that is not the case in terms of increasing your immunity from this particular virus. Though natural infection does give you a certain level of immunity, it does not give you the same level of protection as the vaccine does, which significantly increases your immune response to this particular virus. And finally, as Dr. Gruber had mentioned earlier, I know that many of you are struggling in deciding whether or not you or your loved ones should receive these vaccines. But I want to make it clear that 96% of healthcare providers, 96% of physicians in this country have been fully vaccinated. And as a parent of a 13-year-old boy and a 15-year-old girl, I think it's important for people to know that my children are fully vaccinated as well. And I hope you would understand that I would never put my children at risk if I felt like these vaccines weren't safe. I hope this is helpful for those of you who are sitting on the fence, and I do hope that you will get vaccinated. Thank you.
Thank you. Stephen Woodard, Director, Emergency Preparedness Division.
Thank you, Mayor Curry. We're usually talking with you from the Emergency Operations Center about hurricanes or storms, and those are things that we cannot prevent. Today, we're talking about COVID, which can be prevented. So please reduce your risk for COVID. We talk a lot about being Jax ready. Please get the vaccine. Thank you.
Thank you to all of the participants for being here today for this important message. I want to thank all of the medical workers throughout our community who continue to serve on the front lines. A final reminder, if you want to get the vaccine, go to vaccines.gov and find the location nearest you. This concludes the formal remarks. I want to remind our friends in the media to use the hand raise function in Zoom to ask any questions. We will call upon you and unmute your microphone when it's your turn. Thank you. Scott Johnson, News for Jax.
Mr. Mayor, do you hear me okay?
I do.
Two questions, first for you and the second for any doctor who's comfortable answering it. You had said that no more restrictions to our economy or personal freedoms. Is there any threshold where that could change? Secondly, I believe it was Dr. Thielen, speaking of Mayo Clinic, that they are en route to the highest hospitalization rate they've seen since their peak in January, when we essentially had no one vaccinated. Can they speak to why, when we're at roughly 50% vaccination, we're seeing hospitalizations approach those all-time high when we had no vaccinations? I don't know if it's Delta variant or not, but those are my two questions.
Yeah, sure. To take my part of the question, when you go back to the uncertainty, late February, early March of last year, when virtually the entire world was in some form of stay-at-home orders, a spreading virus we knew very little about, hospitals filling up in Europe, and then we saw it happening in our own country, and people dying, and social distancing, stay-at-home orders, masking, and no vaccine. And that's all we knew to do at the time. Fast forward to where we are now, there's significant economic and health risk associated with shutting down our economy and locking people in their homes. We have a vaccine now that's effective. Hospitals are full and busy because of unvaccinated people. So the solution here is to get the vaccine.
I can respond to the second question. Here in the current environment that we're experiencing, while we have a large percentage of our population that is vaccinated, there's a significant percentage that is not. With the Delta variant, as was mentioned by a number of my colleagues, it's highly contagious, high viral loads, easily spread. So it's much easier to spread amongst those who are not vaccinated. There's a small percentage where we're also seeing breakthrough cases. That's why we're contributing to a similar level of hospitalizations to what we had previously when there wasn't the Delta variant, which wasn't nearly as efficacious at spreading amongst individuals.